What is a systematic review? Hello, I'm Paul Glasziou, a general practice researcher from Australia, and I'm going to tell you a brief story to help explain this key concept of reviews of studies comparing treatments should use systematic methods. Let me do that by taking you back to the 1970s, where Jan Stensvad, a young radiation oncologist at the Karolinska Institute in Stockholm, faced a dilemma. He questioned the effectiveness of post-operative radiotherapy for breast cancer patients. But his hospital peers told him their long clinical experience had shown them that radiotherapy was effective and should be given routinely. So what he did to address the problem was to try and find all of the published controlled trials of local radiotherapy for breast cancer. That was an excellent approach to it, and to his surprise, he found a somewhat decreased survival, that is a higher mortality rate, in those that had had the irradiation compared to the control groups that did not have the irradiation. To do that, he combined the studies in a clever statistical way that his intuition told him should be possible, but he went to a statistical friend of his, Nick Day, to actually find out exactly how to do this, and published one of what is probably the earliest meta-analyses. Let me show you a table of that and point out some of the important features. So here's his table 1 in the study I showed you, with the 5 clinical trials that I talked about. So a couple of important things to notice here. First is that he found and used all the published randomized trials. That is, he was systematic. Second, he pooled them together and got this statistically significant result by combining them, because each of the individual studies wasn't designed to answer this question. It was too small. But if he combined them all into this one larger study, it was able to answer the question. That was somewhat controversial at the time as a novel technique for doing this, but let's move on 20 years later, and it was becoming widely accepted that systematic reviews were the way to approach the answering of clinical questions like this. And the Cochrane collaboration was founded in the 1990s and has since blossomed to become a worldwide organisation undertaking regularly these systematic reviews as what is now recognised as the best way of trying to pool the evidence together to answer important clinical and policy questions. Let me show you beyond Stensvad's table what the results of these now look like. A key thing is this meta-analysis, or so-called forest plot, because it looks a little like a tree with the eye of faith, and point out a couple of features of this. First is that there's a table there, effectively, a little like Stensvad's table, listing all of the studies and what the results of those individual studies are. But in addition, going to the blue section, you see there's a plot of those, which plots the estimate of the effect from each of the individual studies, and then pools them together in that diamond at the bottom. But they're not given equal weight in that pooling. If you look on the far right-hand side, you can find the weight of each of the studies, and that depends on the size or the statistical power of each of the individual studies, and the bigger studies are given more weight. Another feature is that there's a line down the middle usually that marks the line of no effect, or where the treatments are equal. And for a difference between two things, the line would be 0. If we're looking at ratios, that line will be 1. But the line represents, in either case, whether it's 0 or 1, the line of no effect. And everything here is to the left, and the diamond is well away from that, indicating, in this case, it's favouring treatment. So that's a very brief explanation of the forest plot. If you're really keen to learn more about that, there's an excellent video of this by Steve Woloshin explaining what the Cochrane logo means and how it came to be and what the individual components are. And if you want a longer history of evidence synthesis, you can go to this article in the James Lind Library to learn more about the process of evidence synthesis. Just to finish then, to point out the importance of reviews as a part of science. Lord Rayleigh in 1885 said that if science consisted of nothing but laborious accumulation of facts, it would soon come to a standstill, crushed as it were under its own weight. Two processes are thus at work side by side. The reception of new material, that is new studies, and the digestion and assimilation of the old. That's the process of doing reviews, and importantly of doing them systematically, or the systematic review. Because not all reviews are systematic. Just to give you a brief classification, some different types would be the traditional review, which usually involves no search strategy and no selection strategy. Whereas a systematic review has a focused question, like the radiotherapy for early breast cancer that Sternsvard had, and uses a systematic search to find, appraise and summarise all of the high quality search that can be identified. And sometimes those systematic reviews, in fact quite often now, they will meta-analyse those. That is, they will statistically pool the results of the included studies. So, that's the basic story and principles behind the key concept that reviews of studies comparing treatments should use systematic methods. I hope you learn to find and use such systematic reviews, and maybe one day even do one yourself.